Hello and welcome back to another edition of GNAT-TV's In-Depth series. I'm Andrew McKeever and it's Tuesday, March 25th, and we're here today to take a look back at the COVID-19 experience. 5 years after the arrival of the pandemic, we wanted to explore kind of what we'd learned, what it was like, and how did the pandemic change us as a society, as a country, as a state, as a town. Um, Once firmly trusted institutions like government or public health, the media, education, all seem to struggle a bit in the trust department from a lot of people. So we're just going to explore a few questions here with our very distinguished panel that we have with us today, and thank you all for making the time for this. Joining us today are John O'Keefe, who is an athletic administrator at Williams College and was also the town manager of Manchester back when the pandemic first began in March of 2020. Randi Lowe is the superintendent of the Bennington Rutland Supervisory Union, and she was here, of course, to talk about the education side of all of this, which was, of course, a big element in the entire event. And John Burnham is the executive director of the Manchester Business Association. So, thank you all again for making the time. Okay, well, I guess I thought just to get us started, why don't we just go around the table and have each of you just sort of weigh in or tell us a little bit about what comes to mind when you think back to those crazy days of mid-March of 2020. John O'Keefe, why don't we start with you? You were right on the front lines there on the government side of things, trying to make sure that what we were hearing wasn't going to get too out of control locally. What was that like?
Well, thanks for having me, first off. And it's hard to believe that it's been 5 years. Of course, it seems like just yesterday. And obviously we're still dealing with the aftermath of what happened during COVID. I was actually down in New Jersey when the first case in Vermont was recorded, and that was in Bennington. So of course it hit home. We were at a soccer game. The U.S. women's team was playing Spain. And I remember after the game, usually the players would come to the sidelines and like say hi to the fans, and they had announced that in order to keep the fans safe, the players weren't going to do that, which I thought was kind of interesting. I think it was actually the other way around. But that's when I got a phone call from Tom Sterling, who was our deputy health officer, and we had appointed him to be the health officer for infectious disease a couple of years earlier, thinking it might be like measles or the chicken pox. Turns out it was something that we didn't even think about. Spent the whole day on the phone, and shortly after that, I think it was on Monday, because the news hit on a Saturday or a Sunday, I can't remember. That Monday, we had brought in town employees, department heads, Ivan Beatty, the chair of the select board, Tom Sterling, to talk about what our strategy would be. What is this thing? I mean, nobody really even knew what COVID was. And from there, it really, we started doing a lot of prep work. But first thing we started doing was stockpiling food. We thought that we may have to quarantine town employees in order to get services done. From there, it kind of, I'll let these folks talk a little bit more about it too. But from there, it was a very long journey. And I think the one thing I find interesting is during Irene sort of brought the community together and showed us what we had in common. I think COVID really did the opposite. It really exposed fractions or I should say fault lines in society between like values that people had, not just politically but culturally, and like core beliefs about what people thought would be personal freedoms, for example. And so I think those are the two emergencies I dealt with most when I was town manager. I think they're vastly different as far as like the outcome.
Mm-hmm. Yeah. Well, Randy, you were right on the front lines on the education side of it. Closing schools and trying to manage whatever was going to come next. Tell us about that. That must have been just a crazy couple of weeks. And you were just, you had been appointed superintendent to take the place of Jackie Wilson, who was retiring at the end of June. And you weren't yet the superintendent, but I'm sure you got handed a lot of emergency planning.
It really was such an interesting time, and I also really do want to thank you for this opportunity. It was one of the things I did as we when you first approached me about talking about this, is I went back and looked at emails from March like 12, even before the 13th, 10th, 11th, 12th, through that following week from 2020. And it really just reviewing all of that communication, it really brought me right back. And we had a in-service day, a professional development day scheduled for March 20th for all of our teachers. That was a Friday. The week before, on that Wednesday and Thursday, 11th and 12th, we started some internal dialogue. Should we move that in-service day to Monday? So Friday, we messaged families and said, hey, we're so sorry about this last minute notice. It was like the first of many last minute notices that were to come. But I know it's Monday and we don't usually do this, but we're going to be canceling classes, moving our in-service day to Monday because we really want to give our teachers time to create blizzard bags. That was the language we used. The only construct we had for remote learning was what places across the country had done in the past, where they would make up little bags and send them home with kids, and on the snow day, instead of playing in the snow, you did work from your house, and it kind of counted as a snow day. So we said, okay, that's what we're going to do. Saturday, Jackie Wilson, the superintendent at the time, Skylar LeBombard, our director of teaching and learning, and I were in contact. Sunday, we realized Sunday morning, this is looking really bad. We called all our instructional leaders to a meeting on Sunday afternoon upstairs in our office. I remember sitting on Sunday with Skylar and Jackie in our conference room. I think Jackie had brought food. It was probably Jackie. She was always great with that. We're not so good, but I remember sitting eating takeout at the conference table, and it was so quiet and so strange. You knew we were on the brink of something very different than what we'd experienced before. So we talked through what we were going to do. We had already been planning. We finished planning. We ate. We go upstairs. Everyone's in the conference room. And we're like, yeah, we're going to go remote tomorrow. But that's it. No kids. We're not having them back. And it was such a sober moment, and such a moment that I literally in my mind have the room where people were sitting, what it felt like, what it looked like. And then we said, okay, we're going to let families know. And we did. And then we started how's this going to be? And that was the beginning. And it's more of a body memory kind of, to feel and remember the energy, the tone versus the details. I feel like there's a time warp around the details. Timing, I really did have to go back and read emails to remind me, but as I'm even saying this, you can sort of bring yourself back to the, oh my gosh, what are we going to do kind of moment. And yeah, I did pretty early on say this is what I'm going to get myself into. At that time, we thought it was 2 weeks, right? We're going to go remote for 2 weeks. That was it. That was the discussion at the time. So, and then we took it from there.
And it was sometime early in April that the governor issued the directive to close schools for the rest of the semester.
Right.
Wow. Yeah. Well, John, you weren't quite yet in as executive director at the Manchester Business Association. That would come later in the year.
Not too far in the year. Again, thanks for having me, Andrew. I really appreciate it.
Well, thank you for coming. So I guess on the business side, then I guess that was also a big adjustment for a lot of local businesses to have to make. And I remember one of the flashpoints was kind of the whole face mask thing, early on anyway, that customers who didn't come in without face masks kind of created some tension sometimes.
Sure.
But anyway, what was it like in the beginning for the businesses when they had to adjust to this?
So at the time when this all started to happen, I was the general manager at the Kimpton Taconic Hotel. So, and similar to both John and Randy, we were starting to hear things that were happening across the country. Being part of a national company, Kimpton Hotels across the country, obviously those cities were hearing things before we were having cases here in Vermont. And so we were getting communications from them, and we were planning on things to happen, but of course paying very close attention to what's happening in Vermont. And I remember very clearly the first executive order that came out that said, restaurants needed to cease operations unless it was takeout, which was on March 17th. And actually this day in particular is very special, if you want to call it that, because this was the day the governor put in the stay home, stay safe order, which then resulted in the entire hotel having to close, as many lodging properties did around the state on this specific day 5 years ago. And that, was the most challenging part. I mean, of course, you can adapt and you can make things happen, but to, go from 96 employees, fully employed, working hard to take care of so many people, to down to 4 at that point, and not knowing what the future was going to bring, whether this was something that was going to be, at that time they were thinking, in a couple of weeks we'll be in better shape perhaps, and of course that did not occur, and we actually, it wasn't until almost the end of May before they kind of lifted that restriction on public gatherings, and hotels that were non-essential being able to reopen. Restaurants being able to do on-premise dining wasn't until the end of March. And even then, of course, came the restrictions and the requirements that made it very challenging for many businesses throughout Manchester and the surrounding areas to reopen and operate. Those who already had kind of the takeout feature as part of their normal day were able to kind of go through that process all the way through that March and April period into May. Those who didn't had to try to adapt, weren't able necessarily to do so had to close down their operations. And then when this came, and this is where the town of Manchester was great as well, working with businesses and allowing them to expand their outdoor capacity or create outdoor capacity they didn't even have that summer, because places like, and I'll just give it, like Christo's Pizza that only had indoor seating, they were able to put out tables and chairs on the sidewalks. Again, still, there was that 6-foot distance, so tables had to be 6 foot apart, and people had to wear face masks, and even just standing in line, you had to be 6 foot apart. I remember, and even today, even if you go around different places, not only here in Vermont, around the country, and you'll see those lovely circles on the floor that bring back memories of how far you had to stand from the person in front of you when you got in line. So all of that, just went on for quite some time, much longer than any of us thought. And it was tough. It was tough on the individuals who were experiencing being laid off. It was tough on the businesses who didn't have any revenue coming in. So yeah, it was a pretty tough time.
I think it was, on the restaurant side, it was interesting too, because certain restaurants just had a competitive advantage, like pizzerias. Yeah. People would take that away, or burrito places, but like if you're serving up like, a fine steak with like a demi-glaze, people don't want to take that away. So I think that was interesting. There was, during the early phase of COVID too, I think there was a lot of wishful thinking that, this will go away, because we'd had things like this, like we've heard about Ebola, outbreaks and all sorts of outbreaks in other areas, and they just kind of fizzled out. Mm-hmm. Like monkeypox never really, we've always heard this all the way through, like, through the last several years. And I think there was sort of like a hopefulness that, this will be, all hunker down, and 2 weeks from now we'll be outside, we'll be having fun again. And it just didn't come. It just didn't come to fruition that was what happened.
No, it's funny. One of the things I want to add on to that, sorry, because it was one of the things that I found very interesting. The state liquor control board, just after they asked restaurants to stop serving on premises, but could do takeout, they also for the first time said, you can take drinks out. Yeah. So think, for people that were, that which kind of helped. And we actually kept the restaurant open, the Copper Grouse, for another week until the hotel, everything closed down, trying to do takeout, which we weren't necessarily equipped for at the time, but we tried to make it work. One, because we wanted to try to bring in revenue and keep people working, but two, because people needed places to go and get food that they weren't able to get as easily through other channels. So anyway.
The supply chain stuff too was interesting, because you probably had trouble getting the takeout boxes because everybody was hoarding those.
Yeah.
Or we, through a contact that we had an early opportunity to buy thousands of surgical masks and the KN95s, and we were able to get those. But I mean, who doesn't remember the toilet paper?
Clorox wipes,
like all that stuff was just totally wiped out. But you must have had trouble getting to-go cups for liquor, or the cardboard boxes that you put food in, because people were.
Prior to and after, when we reopened, it was very difficult, even at the end of May, to get some of these supplies back in after being closed for a month and a half, almost 2 months.
Yeah, well, that was boy, that takes me back. Well, I wanted to ask you all what you thought, some of the long-term impacts of it all has been. There's been a lot written and discussed about how the experience of the pandemic really changed, the country in some ways, or revealed certain fracture lines. I'm not sure what the right term is, but the response that we saw as a nation around when the vaccines became available, and some people were eager to get them as quick as possible, and others were going, how do I know that's the right thing to do, or do I really want to? And again, the whole face mask thing, it revealed kind of a split in a way between kind of the individualistic characteristic of the country versus a community thing. And like I said at the top of the show, institutions seem to take a hit. Government, education, media, everything seemed to be not as, just because one of those institutions said, well, this is the way we think it ought to be, wasn't immediately accepted by 100% of the population. Right? But I guess I just wondered, when you think back on how we've changed, whether it's a community or state or a nation, what comes to mind? Has this experience made us stronger in some way, or has it revealed some underlying issues that we need to address at some point? Anyone can go first. We're all looking at you, Randy.
Oh gosh, there's so many ways to answer this question, and I think in the immediate, you're asking about long-term impacts, but I think that people were really living in a lot of fear, or a lot of concern, or a lot of anger. Right? There was a pretty high level of intense emotion by most people. When I will say that I look back at those years and think, wow, we really have an incredible community. I think people really knew that we were doing the best we could under unprecedented conditions that we couldn't have prepared for. I think people knew that we had the best interests of our children and staff at the heart of decisions. That did not mean they always agreed with decisions. And so when I think back to early, like August of 20, September of 20, when we were transitioning back to school and making some very big decisions, and I felt a huge responsibility. We were talking about the children in our community, and the last thing I wanted was something awful to happen to any of our employees or our kids. And so I felt the weight, and you're getting feedback and input from the Department of Health and from the Agency of Education, and you're looking for clarity and you're looking for certainty, and people are only as clear and only as certain as they can be, which in that type of a situation, it's never quite enough. So you go into the decision saying, hey, I'm making the best decision I can right now with the information I've got. And I would sit there sometimes. I am not kidding. I probably spent sometimes almost 10 minutes before I had to hit enter on an email to send some big piece of information out. And I would feel it. I felt it in my system, and inevitably I knew whatever decision I made, I was making the best decision I could at the moment. But I would always receive feedback in one of two camps, and both camps at the same topic. Thank you so much for taking care of our children, and I know this is difficult, and thank you for keeping them safe, and you are a terrible person who doesn't care about our kids. The same decision I would constantly get, and I think that going through that experience shaped me as an educational leader, because it really, to your point, it really highlights we are a public institution serving the public, and we have a wide range of perspectives and beliefs and feelings with all of our community members. And how do you lead and bring everybody along as much as possible? And I really tried to listen to everybody's perspective and opinion and recommendations and suggestions, because I think at the end of the day, everyone wanted to help. Everyone wanted to help us to make the right decision. And it wasn't about whether I agreed or not. It was, yeah, I'm listening and I'm hearing you and I'm adding that perspective to my repertoire, and maybe it'll help me ask a better question to the Department of Health or to the Agency of Education. And so I look back and I think that it highlighted that I've carried forward with me, right? Our children are certainly affected. We will continue to not know the magnitude of developmental impact on our youth. We will not know the full impact for a long, long time. We see things on our kids coming in today. We were just at a meeting last night and we were reviewing some academic data, and I'm really proud of the growth that we're seeing in our kids. We noticed that there are a couple of grade levels that didn't have the same level of growth, and that led to a conversation about those kids being in kindergarten and first grade when their education was really interrupted, and when kids don't have access to really solid foundational skills. Could that be? Maybe not, right? But we're still going to be talking about that, the social impact on relationships, on communication, the amount of time that kids spent in their homes away from peers using technology, like the whole confluence for sure has affected kids, and it's affected our programming. I'll let somebody else take over. I could probably literally spend an hour just talking about the multi dimensions of the impact of the pandemic on education, but I won't. I will say I was so proud of our employees, of the people, the teachers, the staff, our leaders, our parents at the time, and I remain unbelievably proud of the work they do. It was so difficult. It's a difficult job under the best of circumstances. At that time, we were thrust into something that we had never experienced, and our folks just rallied and cared and were exceptional. So it's a lot. But
I had some kids at home at the time when Burn and MEMS decided to go remote, and it is interesting too. I think there will be some really interesting studies about socioeconomics, its impact, and a lot of people have talked about like the difference in gender and how it's like impacted like academic achievement. I mean, for me, anybody who knows me well knows I'm a huge student of history, and I think you look at these events that just turn human history on edge and make these huge pivots, like World War II or the Civil War. One that comes to mind all the time when I look at this, because there's so many parallels, obviously at a different level, but even the bubonic plague in Europe, like a lot of the things that we saw as far as like massive changes to society. And actually one thing was that was interesting is a lot of people that could escape the cities during the pandemic did, and they came to Vermont. Mm-hmm. And that was something that happened in Europe too, actually. So there were a lot, history repeats itself, of course, and we're supposed to learn lessons. We never do. Mm-hmm. But I think that COVID was one of these things that really is going to go down in history, and not just changing the demographics and things like that, but the mindset of everybody. I'm hoping that we do come out of it eventually stronger. Mm-hmm. In the European example, you had the Renaissance that came about after the plague. I don't think we're in the Renaissance yet, by the way. But I'm hoping we get there. But there is, I think it's really interesting, and there's certainly be a lot of as we start writing the history of this, and history usually comes like 50 years after the fact, once we can start digging into all the public records. There was a lot of interesting political theater. Who can't remember, or who can forget Andrew Cuomo in his daily I don't even know what I'd call them.
Press conferences?
Yeah, sort of, yeah. That's one word for it. And then you had the president at the time, and Dr. Fauci with his hands in his face. And, and I think that there is this whole second guessing too, which is actually interesting in past pandemics too, with this second guessing of science. The fact that, was it Project Lightspeed?
Warp Speed.
Warp Speed? Was it Warp Speed? Was it
the vaccine development?
Yes, Warp Speed.
Right. Yeah.
One of the major accomplishments of humankind. How long did it take us to cure polio? And we cured this thing, or not cured it, but vaccinated it within a year, less than a year. Mm-hmm. Yet it's brushed aside because of the whole debate now about vaccines. Mm-hmm. And anyone who didn't get polio as a kid, or measles or mumps or smallpox certainly has a vaccine to thank for it.
Yeah.
And that's the other piece I think that's really interesting, is that we've sort of brushed aside the science of the whole thing. And I know we were all frustrated at the time about how long it took to figure things out and like how was it transmitted. But based on previous pandemics, like we were miles ahead because we had already gone through these things in the past.
I mean, that's one of the things that, as I think back, I'm not sure if fascinates me is the right word, but the fact that here we had this novel coronavirus, as it was called, it had never been found before, and medical science was trying to keep up with, was trying to understand it. This was a hard, complicated task. It was, overlaid with a lot of political stuff as well, and the fact that, some people were so impatient that they weren't learning about this quickly enough. That meant, medical people didn't know what they were talking about, and the vaccines were unreliable. There was no slack cut for the fact that this was something completely unprecedented that had to be understood as we got more knowledge about it. And this having all the knowledge we needed didn't happen right away.
I mean, I think people might disagree with this comment, but I felt pretty lucky actually that we had Governor Scott and Dr. Levine almost doing it in the beginning, three press conferences a week, and all of the team at the state were talking about the various things that were happening and trying to give guidance. And of course, then you had Dr. Fauci on a national level that was trying to give scientific advice. I think, as we've seen, and I don't think this virus and what's come of it from the media perspective and the distrust in government and institution was a result of the coronavirus. I think it was already happening before that, and this just bubbled it up really quickly. Yeah, because social media, unfortunately, in some ways is a real benefit for all of us, and in other ways it's not. When you have anybody putting out anything they feel about something, and when you have a bunch of people who are afraid and scared and feeling uneasy about something that's going on, and they're going to that resource to get their news and information, and then they're just spreading what they see because they're like, oh my gosh, that's exactly what it is. There's so much disinformation out there that it takes away from the leaders that are really the ones that we should be listening to and doing what they're asking of us. And I think that if you look at, even when we started to come out of the first few months of COVID, and masks were required and social distancing was required, I'm not sure if you look back at how many of those emails you got that were on the really negative or constructive side and the ones that were supportive and everything, how many were in each queue, because yes, of course there were people that were upset about wearing masks or having to social distance or feeling like their individual freedoms were being taken away. But if you really looked at how many people, and we dealt with this both at the hotel and in other places in business, those folks that were kind of throwing a fit, if you want to call it that, about having to wear a mask or whatever, were so much less than those who stepped up and said, we'll do what we need to make sure that we protect our community and our loved ones from this awful
It was the
virus.
silent majority.
It was the silent
For
majority
sure.
that just came out full force. And we tend to focus on that too much. And I hate to say that they don't have a right and an ability to speak, but even the media tends to just grab onto that and send it back out to everybody as if this is how everybody's feeling, when it's not.
And, there were two sides. There was one side that didn't want to wear masks or didn't want to social distance, didn't want anything to change. And then there was the other side that was reacting totally. One person had proposed that we barricade all the roads into town, which you just can't. I mean, first off, just from a pragmatic standpoint, it can't be done. There's too many entrances.
I remember that there was a period where when
Yeah.
we reopened the hotel, they have people at the state borders stopping people from coming in. I'm like, that's impossible. There's no way they're doing that. But that was out there. That was what was going on.
Couldn't do it. But so there was a lot of pressure. I think Randy probably saw it too, and John, that there was all this pressure to overreact. And in these sort of things too, like you want to be calm as well. You need to project like some confidence. Even when with the table thing, I remember when they came out with the guidance on the tables, it was unclear if it was between tables or between seated people.
Right. Yeah.
So there was a lot of ambiguity. I'm sure you saw it a lot too.
Absolutely.
That they thought they were writing, and of course they were also banging these things out. These
It's
I
fast.
forget the office that was in charge of putting out all the business notices, but like they were trying their very best and they were trying to base it on science. But then when you got down into the field, when you actually went to somebody's restaurant or a classroom, it wasn't easy to implement.
Right.
It took a lot of like judgment and a lot of like, I think they mean between people that are seated, not the actual edges of the table or vice versa.
Yeah, it did become a challenge, even in the restaurants and so forth, with,
Yeah.
with the restrictions of
What
sharing the
is
place.
6 feet?
What is 6 feet
Yes.
exactly?
The whole wiping down the surfaces.
Oh yeah. Oh,
Which
yeah.
turned out to be not the way it was transmitted in the end.
That's
I
right,
guess. It was more human.
Do you remember food?
Yeah.
Wiping down food early on? I was remembering being
Oh,
at
yeah.
the grocery store and the one ways in the grocery
Yes.
store. You could only go down the
Yeah.
aisles one way. I
Yep.
mean, when you start thinking about some of the details
Yeah.
early on, it was really remarkable how quickly things turned on a dime,
Yeah.
which you never could have predicted that we would have the capacity and ability to just flip how we live life in a moment.
But also how fragile society is too, like the trappings of our modern world. Like, you know, whether it's, I know every time the power goes out the house, I'm always like, well, I'll just watch TV until the power comes back on. Like, you just take things for granted all the time. And I'm like, oh, the TV is connected to the electric grid, isn't it?
And just
Um,
like, and I'm sure you could say more to this, but like even the remote learning, and for people who
Mhm.
were told, hey, work from home, stay home and work. You know, if you were in a particular area, like I was at the time, I didn't have to. I go to the hotel anyway because I was one that had to be there. But I didn't have high-speed broadband. I was on the side of a mountain. Now I do, by the way, which I think is one of the best things. If you want to see something good came out of COVID, was how the focus came on making sure that they tried to run lines
Right.
across the state to those places who were underserved. And I think they've done a phenomenal job of getting that up to speed these days.
Some businesses are still struggling with getting
Yeah.
people to come back into the office.
Yeah.
Like when
Yeah.
you look at like larger metro areas like Boston, where you know the policy might be once a week or twice a week. Some places are saying, "Why don't you come back 5 days a week?" And people are like, "I'm not doing that."
I think that's true even here.
Mhm.
There was such a shift to working remotely or a hybrid type, and people had flexibility and they experienced flexibility they hadn't had before.
Mhm.
We're struggling to fill positions. I know that occurs in the restaurant industry as well.
Yeah.
I think there's a lot of in-person jobs that we're struggling to fill, and I think that there's a
Mhm.
whole gamut of reasons why, but a lot of people got a taste of what it can be to work remotely and the flexibility that can come with that, and weren't willing to go back to the tight structure of a 9 to 5 in person in an office.
Yep.
And I think that is something that we'll continue to see how it all evolves over time.
I wanted to ask you, Randy, if you thought, you know, in hindsight, if you had to do it all over again, God forbid that will ever happen, you know, bird flu? What bird flu?
Mhm.
Was closing schools the right thing to do? If you based on what you know now, and you had something similar, would you recommend the schools stay closed for months on end, or would it be it's just so important to get kids back into classes and have the education process working and the social process that we have to get reopen as absolutely as early as possible?
Mm-hmm. So yes, it's important for kids to be in person. There's not a doubt in my mind that is important for learning. Looking back, I don't think we could have done anything differently at the time.
Okay.
I
You
don't.
didn't know what you didn't know.
Correct. And I can't imagine trying to keep schools open under the conditions in which we were living March through May of 2020. I cannot even imagine what that would have been like. We opened in person. We tried to get open as quickly as possible. And looking back, could we have potentially been open 5 days? Probably. But I don't know that at the time I would have been able to make that decision either.
I think you think about this a lot when you're thinking about policy, like at the government level, and how much risk is society willing to take for the outcomes. So like, I don't know how many people die on the highway every year, but it's thousands and thousands of people that die on the highways. And I could eliminate almost all of them by making the speed limit 10 miles an hour. But that would be such a massive trade-off when you think about how long it would take to drive to Albany. It would take you 6 hours to drive to Albany if the speed limit was 10 miles an hour. If you hit anything at 10 miles an hour, chances are you're gonna probably just dent your bumper. So I think it is like, clearly at the time society just wasn't willing to take a risk of like how many people, like when you looked at like the nursing homes and places like that too, and schools and these vulnerable populations, there's a lot of kids in school that have like health conditions, underlying health conditions. So I think it is kind of, from my standpoint, as the town, I think it was the right call. I do too as well, to closing the schools, and they're just so tightly packed, and there's only so much cleaning you could do in a school.
And we didn't know anything about how it was going to impact kids. At that time, we had no idea whether they were going to be more resistant or less resistant. And you know, we're talking about the babies in our communities. You know,
I would agree the same thing from the hotel perspective. I mean, nobody wants to have their business closed and have to go through what we all went through, and our team members that, you know, were out of jobs for months. But, you know, had we just said, no, business as usual, allow people to come in and out of the state, I mean, the spread could have been much worse, not only nationally, but in Vermont. I mean, I remember being so proud, it's weird to say this, but proud of the numbers that we were the lowest in the country, and we were doing everything we could to save lives. And if that meant being closed for a couple of months to do so, it was what we did. And, you know, of course, we all know that there were programs and stuff that were introduced from the federal and state levels that helped businesses and individuals deal with that unemployment or loss of business. Unfortunately, those worked and didn't work in circumstances as they were trying to learn how to do such a mass grants and even unemployment. We found out how antiquated our Vermont's unemployment system was at the time when they got so many demands for unemployment or submissions for
heard
unemployment.
about that antiquated computer system.
Yeah,
at the Department of Labor.
Yep. So so you learn. You obviously
fixed
learn.
or upgraded by this point?
I don't know. Actually,
think
I hope so.
I think the other thing too that's interesting is society really started to understand like what employees are essential.
Yeah.
The one thing that always kind of comes back to me, as far as like essential employees, police and fire. I think teachers were on the list. The DPW folks and the water and sewer operators. So the sewer plant has to be operated every single day. Those folks weren't on the essential list, so they weren't on the priority list for vaccinations, which really, and we had 3 employees, so we literally were just like, none of you can ever work at the same time. So we'd have one person come in on Monday, one person come in on Tuesday, one person come on Wednesday. Obviously, you know, it's highly inefficient, but we needed, if those 3 people got really sick, we would have really been up the creek without a paddle. Pardon the sewer pun. But see, I'll be here all week. But it was interesting that so I think maybe the same thing with the grocery stores. How important people find going to a place and buying food and bringing it home so they could cook it so they can live. How critical people found those folks when that was happening, and I think that you know, it is this kind of it's just an interesting.
Well, it's interesting you talk about the grocery store, because it just brought to mind, you know, what we see today that was a result of COVID, which is people were able to, they did the whole online order, we'll bring it out to your car as a result of COVID, which is now carried to today. And there are so many people taking advantage of that.
Same thing with restaurants
To this
you
day.
can order online though too.
Yeah.
Even locally before COVID, most places in town you could not order online,
Right.
and now you can. People kept that practice, so there is some innovation that came about. Definitely.
There is definitely innovation that came.
And there was Zoom meetings.
Oh,
And Zoom. Oh,
I had
my
never
goodness.
heard of Zoom until
I never did either.
mid-March.
I remember interviews with you, and you were sitting in your closet, I think.
No, that was my home office.
Oh, that was your home office.
That's the space that it gives.
Looked like my clothes. Yeah, right. I mean, that was another whole really totally weird thing.
People are used to Zoom now, though.
Right.
We have Zoom meetings all the time, but
Right.
at first you were like, you just kind of look at it and you're like, this is weird,
Yeah.
talking to your computer.
Well, and remote work was not something a lot of businesses wanted to entertain for their employees, and they understand that now that people can be just as efficient and effective at home doing work than actually coming in and that can give that person a better quality of life
Mhm.
and work-life balance. Sometimes it doesn't work out that well, but
Yeah.
in so many, and it allowed people now to travel and work, and brought people here to our communities, and who now live here year round because they can work remotely for the company. So
And I saw a poll that actually said most people would actually prefer a hybrid of in the office
Sure.
sometimes and
Yeah.
at home sometimes.
Yeah.
It also brings up all these interesting conundrums, though, from the legal standpoint of where are you actually working?
Right.
So, as far as taxation,
Right.
Yeah, right.
people you could work from Antarctica now. I think they have the internet there. But where would you pay taxes to? It's this kind of thing that if you're traveling while you work, it's put in all these layers of complication when it comes to like the regulation of government and taxation.
Oh well, yeah, it was an interesting period of time, one we're not going to forget for a while.
Mhm.
Yes, I'm sure. But I guess we'll have to leave it there. Boy, this was like fascinating. I think we could go on and talk for another 45 minutes, but we'll leave it there for now. But anyway, thank you all again for making the time for it. John O'Keefe, an athletic administrator at Williams College, former town manager.
Go Eefs.
Right.
This is unrelated to my day job, by the way.
Oh, okay.
So I'm not speaking for any higher institutions,
Right.
higher
Okay.
education
Good
institutions.
point. And Randi Lowe, school superintendent for the BRSU, and John Burnham, the executive director of the Manchester Business Association. So thanks again, all of you, for going back into the time tunnel there, and thanks to all of you for being with us. Hope you found it interesting, and we'll see you again the next time. Thank you very much.